Have you noticed puffy or drooping eyelids? Interested in having surgery to correct this appearance? In today's video, we're going to talk about blepharoplasty or eyelid lift surgery and what to expect if you're having it done from pre-op to surgery day as well as recovery. Welcome to Eye School with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week. You've made it to Eye School with me, Dr. D. Welcome, make yourself comfy, and get ready to learn about interventions for drooping eyelids. Before we get started, this channel is all about eye education, and I love creating this community of pupils. If you find this video useful, please let YouTube know what great content I'm making by hitting the thumbs up below. Drooping eyelids, or what we term dermatochalasis, are a common occurrence as we get older. Dermatochalasis refers to loose and redundant eyelid skin and is commonly seen in the middle-aged and elderly. It can affect both your upper and your lower lids, but most people notice it on the upper lids the most. In addition, it does seem to happen as a result of genetics as well. So many of my patients will remark that they now have drooping eyelids just as mom or dad did. As we age, the eyelid skin stretches and underlying fat becomes more pronounced. You may be concerned about the cosmetic appearance this gives, but drooping eyelids can and do affect peripheral vision as well. Thankfully, there's a relatively simple procedure that can be done to alleviate this eyelid drooping called blepharoplasty. This procedure is done by both ophthalmologists and plastic surgeons. I am not aware of blepharoplasty being done by optometrists like me in any state. However, your optometrist does play an important role in prepping you for surgery, making that surgical referral, and participating in your post-operative care. We're skilled in knowing when you're ready for surgery and can potentially help you get in with a surgeon more quickly. When considering blepharoplasty, there's often an important question my patients ask, which is my insurance going to cover it? So let's take a look at some common insurance criteria for this surgery for upper blepharoplasty. The first thing we're looking at is the proximity of your upper lid margin to the center of the pupil, and typically for insurance to cover the blepharoplasty, that distance has to be less than 2 millimeters. So that lid really has to start encroaching on what we call your visual axis or your straight ahead gaze quite a bit. The second thing is that significant visual field restriction due to the lid droop has to be present. So the question becomes, is that extra sagging skin blocking your vision? Lower lid blepharoplasty is not typically covered by insurances because drooping of the lower lid is not really going to impact visual performance. When upper lid blepharoplasty does not meet those criteria that I talked about, it is considered cosmetic and is not covered by most insurances. However, you can still opt to pay out of pocket and have blepharoplasty done, even if you don't meet the criteria to have it covered by your insurance. Pre-operatively before blepharoplasty, you're going to have an eye exam where special measurements are taken of your lids. You'll undergo a visual field, and your surgeon will give specific instructions, but will likely discourage the use of blood thinners like aspirin and alcohol. Most surgeons will also discourage nicotine use beforehand and encourage you to wear sunscreen and avoid excessive sun exposure in the weeks before your surgery. When you come in for the surgery, it's actually an outpatient procedure typically performed right in the office with local anesthesia. You will be awake throughout, but you won't feel any pain. It's important to bring a driver and arrange for maybe a friend or family member to stay with you the night of surgery just for a little bit of extra help. Post-operatively, you'll want to have lots of ice packs to apply because there will be some bruising and swelling that will occur, but it'll go away really pretty quickly. But you want to have those ice packs on hand just to keep yourself really comfortable and encourage healing. You'll be given an ophthalmic antibiotic ointment, and you'll want to put those on the incisions at least twice a day. You'll have some limitations on lifting and strenuous activity. It really is best to chill out for the first maybe 24 to 48 hours. You'll have eyelid sutures in place, but those will be removed about 3 to 4 days after the surgery. You'll have pain medication prescribed or advised by your surgeon if they're advising over the counter. And it is okay to take your artificial tears and do other prescription eye drops, like potentially if you have glaucoma medications or dry eye medications. Those are going to be fine to take in your postoperative period. You do want to elevate your head after surgery, so maybe plan after your blepharoplasty for having or sleeping in a recliner that your head can be elevated, or find some way to elevate your head in bed a little bit to reduce that swelling. You'll want to stop your contact lens wear for a couple of weeks because you have to hold your lids a little too aggressively to put contact lenses in. And so after blepharoplasty, it's best to just stay away from contacts for a couple of weeks. You will be able to restart makeup 7 to 10 days after surgery, but remember that your surgeon is going to have their own specific post-op instructions, and those are going to supersede anything else you find on the internet, including me. Blepharoplasty is a game changer, and patients say that it really gives a big boost in their appearance. For being just a procedure you can have in an office in relatively little time and with relatively little downtime, it's just really a nice surgery that gives a big boost in appearance with very little risk and high reward. If you're interested in seeing if you're a candidate, definitely let your eye care provider know at your next appointment. Even if your eye doctor doesn't do the surgery themselves, like I don't do the surgery, we do have the knowledge and the ability to get you to the best surgeon possible. If you're not quite ready for surgery, I did make a video on an alternative drop that can actually lift your lids a little bit. I'll link it up above. It's more so used for ptosis, when your lid is actually drooping, like in this picture, as opposed to in dermatochalasis when the upper lids are sagging. However, if you're just needing a little bit of a lid lift and not ready for blepharoplasty just yet, definitely check out that unique video. That is going to be it for today's iSchool. Thank you as always for attending. Class is dismissed, and I'll see you next time.